He
He
is.
is right now as we speak. The Chief Medical Officer for the Department of Public Health and Social Services, Dr. Felix Cabrera. Good morning, Doc.
Good morning, Chris. Good morning, Bree. Good morning, Jason.
Good
Morning, Doc.
Good
morning.
to see you all.
I would say,
Congratulations.
yeah, congratulations.
Congratulations.
And I would say welcome to public service, but I kind of feel like you have been serving the public. I mean, it's been a minute for the duration of the pandemic. We'll go ahead and read off this story here. As KUM, we broke this story first Friday. Dr. Cabrera was hired on a 2-year employment contract for $268,000 a year. He's a member of the Governor's Physicians Advisory Group and created the formula behind the CAR score. The CAR score accounts for the incidence of new cases, how well current testing identifies these cases, and the rate of spread. According to the documents that we obtained, Dr. Cabrera's 2-year employment contract, he can't work more than 40 hours a week, entitled to all fringe benefits, including retirement, annual sick, administrative leave, and health insurance. So, again, congrats, Doc. And what'd you kind of make of the new when the story broke and some of the comments that I saw on social media? I know that some of those maybe might have rubbed you the wrong way.
I'll be honest, I did not see a single comment, but my mom did, and so she talked to me about a lot of that. But I think everything's in context and everything is relative, right? And so, but overall, I'm extremely excited, to start this new chapter in my career as well. I think it's been, I think a lot of what I've done over the past almost 10 years here on Guam, I think has really, gotten me to where I'm at this point where it makes sense that I take on this new role and really try and connect the dots, I think, in a lot of ways. I think I only have really one agenda. My one agenda is to improve population health on Guam. And so it's as a whole. And so that's, I think, priority number one. And then, so the pandemic is of course, the thing that's in front of us, and it's the first and foremost in terms of what our attention is drawn to. But so with that, I'm excited. I look forward to the opportunities. I look forward to meeting more people and really learning public health in a more in-depth, detailed process, and hoping to be also the liaison between a lot of different parts of public health with a lot of the both private and public parts of healthcare on the island.
I gotta ask just a couple tough questions, Doc. The salary, I know that raised a lot of people's eyebrows. Is it justified to pay you $268,000 on a 2-year contract? So
that is technically below average of what an average internist, internal medicine physician makes on the island. For comparison, you can look at the internal medicine physicians at Guam Memorial Hospital, and there are many of them there, and their salaries are public record as well. So as you can see, it's comparable. It's technically, not that it matters in terms of what my motivations are, but it's technically a pay cut overall. And so that's, but to me, that's minimal compared to what I hope to be able to do in this new role.
But so your role, is it more of like an admin role that you're going to be taking on as the chief medical officer, or are you going to be out there cutting people open and doing surgeries and whatnot?
Yeah, so it's going to be a mix of both. And so while we're in the pandemic, it's going to be heavy on the administrative operations part. It's more of a continuation of what I've already been doing through the pandemic, just more on an official matter and as an actual representative of public health. As opposed to simply just being a representative of the physician advisory group or the state surgeon cell. And so now I do it, under this hat, and I think that that's something that's going to be hopefully make a lot of the efforts that we do more efficient.
Can you tell us a little bit, or maybe provide a little more insight on the contract negotiations? Because there was some negotiation involved with securing this deal.
Well, it was, I think what the issue was the pay scale that public health had on record is something that hasn't been updated in a very, very long time. And so, it was just basically saying, let's get me close to what an average GMH internal medicine physician makes, because that's a government physician employee, and we're good. And so it was just that part.
What about that 40 hours part? I was talking to some doctors over the weekend, and they were like, "Wow, that he got it made."
No.
How's that going to work? Because
what that really means
okay,
is that I don't get overtime. That's what that really means, and that I'm not eligible for overtime. It's a salary. So it's just that I'm not allowed to work. I don't even recall reading the allowed part, but that's the clear understanding that our director Art St. Augustine and I had, that it was that there would be no overtime, which is important because the job's essentially 24/7, and I have to be available for a variety of issues that could come up at any time.
Right. So I'm sure there are critics out there who would look at this and say, "Oh, he went to bat for the governor. He had her back during the pandemic, and this is the reward, so to speak." How would you respond to those type of comments?
Well, I jokingly respond when people congratulate me as saying, "Oh, you mean condolences?" But but the joke, just because the reality is that the work is going to get harder in this new role, and then at the same time, if this is a reward, that's news to me, because and in terms of a monetary reward, because that's not what it's gonna, at the end of the year is what's gonna say in terms of what I have to do when I file taxes. But really what it is specifically a reward that that the efforts that we put forward now, we can actually put a lot more of it in motion. There's so many operation plans that are currently present. They're in draft form, but it's very difficult because everybody's stretched thin. And so now in this more official position, then we can actually now effectuate a lot of these operation plans. And this goes from not just vaccines, but this is also continued testing, and which is a very, very important part of what we need to do, in our battle here.
Last one was, what is that? So it says you're going to maintain your hospital privileges. Does that mean that you're still going to be practicing on the side?
Yeah, and so especially for the past 5 years, I've been primarily a hospitalist, and so that takes you have to keep up those skills as well. It's very different than just outpatient clinical internal medicine work, including I have privileges in the intensive care unit at GRMC, and so I have to keep those skills up as well. So I will be still doing some clinical work there from time to time.
I just wanted to follow up on something you said regarding GMH, and you said internists make more money than you do at GMH. Is that what you're saying?
Well, I forget what the actual average is, but it's right around there, just a little bit above.
Okay, so are you saying then that your responsibilities are more than an internist over at GMH?
They're very, very different at this point in terms of responsibilities, because in terms of being an actual hospitalist, because these are GMH hospitalists is what I'm referring to as well, and which I was one before. People really don't know that when I first came to Guam, that was my job. My full-time job was as a full-time hospitalist at Guam Memorial Hospital back in 2011. And so that's really, but it's a different, a whole different category. But when you think about the specialty in itself, what is the market value that's fair?
But is it?
Yeah, I just asked because you brought it up. Yeah.
Is it kind of apples and oranges though, Doc, to say that this is what a hospitalist makes and that's why I got this salary, when you're not actually going to be doing the same type of duties? It's a lot of admin stuff.
Well, at the same time, in order to do a lot of what we do, in order for me to do what I can do, it's the skill sets that I've developed and that I have, and the training that I've had. It's the experience part of it, and so that part is that what it's worth? Then I think that's what we have to we have to focus on and look at that part there as well. A typical, I think, administrator can make over 200,000, for a lot of their work here. And so I think that's, and me myself as a board certified internal medicine physician, I think that's what, I think it's definitely what my worth is. And I shouldn't have to apologize for that.
Mm-hmm. When's the last time we ever had a chief medical officer? Do you know?
This is, so this is a little bit new. It basically is the medical director, right? And so there's the medical director that has duties. And with each clinic, they have their own medical director. In a typical healthcare organization, you have a medical directors of different areas, and then you have a chief medical officer that is basically oversees their work as well, and the entire organization's clinical work as well. So this here is where I will serve in those roles as well, but then be more part where I'm not just focused on just the community health centers, for example, that this is more of a broader role and a lot more on my shoulders, so to speak, than just a medical director for one of the community health centers.
So you're the first ever chief medical officer for the government of Guam, or public health?
It sounds like it.
Okay.
for public health, yes. Yeah.
All right.
I don't know. I can't speak to the historical parts, but yeah.
No, I tried to ask Janola who was the last chief medical officer. So
we did have a couple comments here, Doc. Ken writes in, you don't need overtime or differential pay adjustment with that kind of salary, just saying. Mona writes in, listening to some of the questions being asked of Dr. Cabrera has made it clear that many do not understand, one, how bad the shortage of physicians are across the nation, and two, how much these local doctors can easily make off island. They went to medical school and completed residencies in order to be a physician. Now to be expected to practice medicine and take on an administrative role is even harder. Thank you, Dr. Cabrera, for moving into government and public service. Don't mind too much the questions. Now, as a public official, it comes with the territory. We're lucky to have you in our public health system.
I really appreciate those words and sentiments, and I'll be honest, this is the worst thing I hate talking. I mean, this is the one thing I hate talking about the most, because I don't want to focus on that. I want to focus on what the work is here. And I don't want to. It's because one of those things, like, I don't want to humble brag. I don't want to do any of that.
How do you respond to it, right?
Mm-hmm.
Yeah, but I'm sure you understand that it's relevant because we're looking at what's probably going to be one of the most difficult economic years for the government of Guam. So anytime someone's hired with that kind of salary, whether they have a PhD behind their name or what, I mean, it's relevant for us to ask the questions.
Right.
I know you understand.
And just for people, I did ask Dr. Cabrera when I first put out the story. I did ask him for a comment. So it wasn't that I was trying to actively go after him. It was just that I saw it. Chris and I were talking about it.
You don't gotta apologize.
No, well, I just want to make sure everybody knows that we did reach out to him. For
and
comments.
Doc, I mean, you've been coming on for months answering tough questions. So, I mean, and when I asked you to come on Monday, you're like, yeah, okay, sure, no problem. Yeah. So let's switch gears a little bit now that all the tough money stuff's out of the way.
Mm-hmm.
COVID, right? So I think I heard Crystal said we're in the recovery phase, right? So that being said, what do you think is the next big thing on public health's radar from a community health standpoint that you're going to be, tackling this year?
So really, our efforts to keep the CAR score low is basically, it's basically a three-pronged approach in that we, one is what's very clear is the vaccinations, in that what we'd have to do and the rate of how we're vaccinating and how we're going to expand that, and so that there's a very clear plan that's laid out by the state surgeon cell and in partnership with public health and with Adelup, we're figuring out how to effectuate that plan. And then number two, it's the testing. We cannot keep our eyes off testing. We have to keep focusing on it and not forget it, and continue to figure out how to expand it. We have a plan for that as well, and how not just expanding. What I mean specifically is serial testing. And actually, in certain areas, testing employees, for example, in a lot of the major Guam agencies on a very regular basis, and so that's a big undertaking. And probably the biggest one of that is GDOE. And so there are a lot of work and plans on how to put that through. We have ordered through HHS and DEMA about 125,000 more Binax antigen testing, and so that is something, and we want to use that up in 3 months. That many. So just so everyone's aware, to date we've done about 105,000 tests since the beginning of the pandemic, And so, so just thinking about that scale of what we're trying to do here, because we're going to be in this fight for a long time, and so we have to really do everything we can and we can't just focus on one thing. It has to be multiple parts. And then the third part, of course, is the continuing of in contact tracing, isolation, on that part, quarantine, making sure that part is still very secure and it continues to improve in its process. So those are the three main things that we want to focus on. And of course, and then the fourth one is everybody else's responsibility, right? So to wash your hands, wear your mask, and watch your distance, and have the willpower to do it 100% of the time.
Doc, I wanted to follow up on, you mentioned the priorities. So vaccination, we'll start there. What is the update on expanding vaccinations to allow for private clinics to administer them? I knew that was something that Dr. Nguyen had mentioned last week. Crystal Pacos Augustine was also on last week, so that was the plan. Hopefully this week to begin that process. So where are we with that?
So we're actually we're doing pretty well, I think, overall. I was trying to get an update this morning, but Dr. Nguyen, with AMC, for example, they've been doing everything they can to meet the criteria. Now, this is criteria that's set by CDC. And so, so if you don't follow these criteria, then there's reason to believe that you won't be able to properly not just handle the vaccines, but administer the vaccines as well in the safest and most effective way. Because it's one, there's safety, and then you want to make sure that that the actual vaccine that gets into your arm actually is of quality, right, and actually works. And so there's a certain baseline standards that have to be met. My understanding is that they've essentially met all that. But I don't know what the update is for today specifically, but I know we're going to talk about that at 8:30 in the governor's meeting, and we're going to see what happens. But I understand that AMC has, what they want to do, at least initially, is vaccinate those Medicare patients who are easily already qualified for, to be in the 1C category at minimum. And so they are scheduled for their annual wellness this week. I think there's about 300 of them or so. He wants to incorporate that. So this is not, we're not talking about them joining in and doing mass vaccination. It's really just taking that opportunity. You have them in the clinic, you have them right there, and let's get shots in the arm.
Mm-hmm. So that is the plan eventually, to allow the private clinics to administer the
absolutely.
vaccine, not just AMC, but other private clinics, as
Right.
long as
and
they
so
meet criteria.
That is a key part of the buildup in order to continue to vaccinate more people and to do it in of course, a more orderly way. And that's a great way to do it. And so that's something that we looked into. We have also explored different options of even doing other mass sites as well. And so there are a lot of things that we're looking into, and more that will be announced as it gets fleshed out. But yes, of course, UOG Fieldhouse, that's kind of one of the obvious ones, right, that a lot of people are suggesting. And of course, we've thought about that, and of course, we've been talking with UOG. And so there's actually some a pretty good tentative early talks on that, on how to actually make that happen. Because remember, we're already using a lot of UOG resources even at Okudu, and so that's something to consider. So how do we ensure that there's a proper spread and the right balance throughout different sites?
Mm-hmm. Can you confirm, because we did have the mayor on, that there will be vaccination clinics down at Inarahan on Thursday and Friday?
Yeah, I can't confirm that because I don't know that for sure, and it's not what's been released in the JIC. I always want to default to what's in the JIC reports, because this whole process is fluid. We're constantly changing, we're reevaluating, we're pivoting, we're learning from our mistakes, and actually welcome the to learn more from our mistakes, because those are opportunities to do better. And so we don't shy away from the failures or the places that we can actually improve, because we have to focus on that so that we can do that better. So, like, for example, on Friday night, we had our meeting with the governor and public health and the surgeon cell. There was a pivot basically to have all the healthcare workers on Saturday go to GRMC. And so there was a back and forth about that. But the JIC reports before that were already saying that, that time difference, 9 to 12 was healthcare workers at Okudum. But, we made that pivot and it ended up being very, very successful. We were supposed to do 350 at GRMC. We ended up doing over 500. And so that ended up, turning out to be a really good pivot, for example. And then in just that day, Saturday, we vaccinated over 1,700, almost 1,800 people on Saturday. And so that's a large amount. And so by the way, in the 3 days of vaccination, so on Thursday, Friday, Saturday of last week, we've almost doubled as the amount of vaccinations that we had done from all the days prior since we started beginning vaccinations. Mm-hmm. So we are really improving how many we can vaccinate on, and it's improving on an exponential rate at this point.
When does the homebound vaccinations get underway?
My understanding it's this week.
Doc, I feel like a newbie here, but we had a question in the comments. Vaccinations given to children under 16, yes or no? No, right?
Still being studied.
Okay.
The trials are still going on. And so I don't know the timing of when those studies will conclude and then when we'll get word of its safety with children. We expect it to be safe with children, but we absolutely can't do that until the FDA gives us the okay.
And I also wanted to ask you about the variant. What have you studied? What have you heard? What type of research are you doing on that?
So far, well, the best part about it is that both the Pfizer and the Moderna vaccines appear to be very likely effective against these strains that are most common that we know about, like the one in the United Kingdom and the one in South Africa. So those are the two examples of the ones that have high effectivity rates.
So GDOE, they're going to be appearing before the legislature, and one of the things they're going to be talking about is vaccinations for personnel there. Have they moved up on the priority list, and will they be getting vaccinated?
So they haven't necessarily moved up, but they're already high on the priority list. Mm-hmm. And so we're just not there at their level at this time. Now, the good thing is that there is crossover. There's some that are 60 and over and that have probably already gotten vaccinated. So that's good. But they'll be coming up soon. That's for sure.
Mm-hmm. Have you heard anything about the change in the P Corps status?
No update from what was reported last week, especially from the lieutenant governor, but then the intention is that, and so far we seem on track to a declaration of P Corps 2 at some point, definitely before schools open next week.
Mm-hmm.
Are you going to continue to serve on the Physicians Advisory Group?
Yes.
Okay.
I wanted to ask, is there an update on the antibody treatments over at GMH with the convalescent plasma and the Bamlani VMAP? Do you have any updates on that?
Yeah, so they're still available. They're still there for treatment. What's great is that we essentially haven't had much use for it, right now, knock on wood. And so at GRMC, the outpatient infusion clinic that's there, they have not infused bamlanivimab in over 2 weeks now. And that's mainly because of the low number of cases and we haven't received any referrals from outpatient providers.
I do have a question from one of our viewers regarding just going back to the homebound. Why aren't the caregivers allowed to have it at the same time?
That's actually a question that was discussed, and that's something that we're looking into. There wasn't a final decision about that. Again, we have a limited number of vaccines. Okay, we have to remember that part. We are trying to scale up, of course. Now, HSP is the agency that's going to be going on and giving this. And so sometimes, but the topic was brought up on Friday evening about saying, why don't we ensure that they have like maybe 1 or 2 other doses in addition to that homebound person that you may want to take that opportunity to vaccinate. And if that person is, especially that person is already fits the criteria that we're in terms of being 1C and 60 years and above. But in my opinion, if somebody's homebound and that primary caregiver, they're essentially a healthcare worker.
Yeah. Well, so, you're the chief medical officer.
Yeah,
make it happen.
We had another question here. Any change to inbound traveler quarantine? It's been a while and a lot of things have changed since the last one was released. What if you have the vaccine? Are you able to bypass quarantine?
There is no immunity passport, essentially at this point, and that same thing. If you had COVID, doesn't mean that you're exempt from quarantine from after you travel. And so right now, as it is with the vaccines, there's no hard evidence that we can say that that it's safe to reduce the quarantine for persons who have been fully vaccinated. That data is going to come out, and once that come out, then we'll feel more comfortable. But we just don't know what the potential spread might be. You may be one of those that had the full vaccine, but still get COVID, and they're still able to spread it. So that risk is still very much there.
Any more questions?
How did the town hall go yesterday? The virtual?
Sorry, go ahead.
How did the virtual town hall meeting go yesterday?
I think it went very well. I think the panelists did an amazing job. Especially Dr. Annette David, and she did the initial presentation. And so then really good questions that came out of it. Unfortunately, I had to drop out early. I had an urgent patient matter that I had to attend to. But I was there for at least the first hour of it. And so I was, there were great questions, and I appreciated that, and I appreciate the interest in the town hall. And we'll have more of them. I think that's for sure. And I think even some with different groups that are requesting similar town halls, like the Chamber of Commerce, and so we'll see how that gets organized.
All right. I know everybody's waiting for that 2-week period after New Year's Eve to see how we fared. I know it's just the 11th, and we're coming up on 2 weeks. How do you think we're doing so far? I know the CAR score says 1.3, but we're still seeing positive cases. Yeah.
And so, our test positivity rate is looking good. It's below 3% right now. Overall, it's actually at 2.5%. Our daily new cases per day, I get 7-day rolling averages are the numbers I'm spitting out here. So it's about 10 positives per day on average over 7 days. And then, so those all look promising. And then also, what we've developed is this way to kind of gauge how are we doing enough tests. And we think that a good rule of thumb is that for every 1% test positivity rate, we should be doing at least 100 tests on per day on average. So at 2.5%, we should be doing at minimum 250 tests per day. Does that make sense? And so right now we're doing over 400 tests per day. And so we're doing good on that part. I think it's a good representation of what of what's going on in the community, at least at this point. But at any point, we know that an outbreak can happen. It can be sparked, and so we have to keep our eyes closely on it. I do have to go soon, but the last thing I do want to point out here is I know that there's been a lot of frustrations with the vaccinations and the long waits and the confusion that sometimes bear from it. But Guam needs to be extremely proud of where we stand in the nation in terms of how many we've vaccinated. The New York Times keeps a running tabs of comparing states. Guam hasn't been updated in a couple of weeks. I don't know why, but we have vaccinated. We have vaccinated approximately 5.4% of our population right now. Majority of the states are struggling to even get to 2%. So we have done an amazing job right now. So there are over 9,000 people that have had at least one vaccine. And we've given 10,000 vaccines already. So that means there's almost 1,000 people that are already fully vaccinated. So we need to be very proud of what we've been able to accomplish, but it's still not enough when you think about it. I'm here, saying that we're proud of 5.4% when we have to get up to 80%, for example. So, but at least relatively speaking, we're doing well. I think the more efficient we are, the more likely we're going to get more. A lot of states there's talks about states being punished or penalized for not rolling out the vaccines fast enough, either by fines or just we're not giving them any more until they use up what they have. So we need to keep this momentum going. We need to keep building up and great job, Guam. Your interest is great, and I think everyone should share their experiences and join the vaccination.
There you go. We're waiting to join too.
I was all like, I thought we were essential.
We sent the list already to public health.
Maybe we got to ask fewer tough questions.
Yeah. Well,
Doc, yeah, thanks, man, for coming on. Appreciate it.
No problem. Okay, take care.
Take care.
Be safe.
Be safe, you too. Okay. Hey, it's 8:09. We're KUAM FM. I got Guam. That was